Hello and welcome everyone. We are glad you are joining us for the fourth in the six-part Child Care Emergency Preparedness and Response Plan webinar series. This is Susan Rohrbaugh, Region 5 State System Specialist of the Child Care State System Specialist Network, a service of the Office of Child Care, and I'll be moderating today's webinar. As we begin today, I'd like to recognize that this is National Preparedness Month. We are very aware of that as we go into this particular month of planning and preparation for this webinar, that National Preparedness Month is a good time to plan ahead and prepare your emergency kit for the next severe storm or hurricane. In addition, Save the Children recently released their 2014 disaster report card. So it's another time to be thinking about training and technical assistance supports for child care providers in the communities with which we work and support. And lastly, I'd also like to mention the upcoming October 2nd webinar hosted by the American Academy of Pediatrics on influenza prevention and control strategies for caregivers who work both with Head Start and with other early education and child care settings. The webinar is a collaborative effort of the AAP and the Centers for Disease Control and Prevention. So we're really excited and happy to be offering that information to you if you have not received, and also in recognition of National Preparedness Month once again. So now let me turn now to my colleague, Lori Sommerfeld, who will walk you through technology logistics. Lori?
Hello, everyone. It is great to be here with you this afternoon. I just wanted to run over a couple of quick notes before we get really into the swing of things. First off, I want you to know that this meeting is being recorded so that we can provide all of those who registered with a copy and so that it can be posted on our Child Care Technical Assistance Network website. The webinar is being broadcast through your computer speakers, so hopefully everyone can hear me right now. We did a bit of a test a couple minutes ago. If you have questions for the presenters about the topics discussed, please write the question in the Q&A pod that is in the top center of your screen. These questions will either be addressed in the Q&A portion of today's webinar, or we will follow up afterwards. If you have general comments or an immediate need, they can be entered in the chat pod that many of you have already taken advantage of in the bottom middle of your screen. Unfortunately, on a webinar with this large of an audience, we are unable to do much about troubleshooting for individual participants, but please keep in mind that if you're experiencing trouble with your technology, a recording of this webinar is being sent out to all who registered tomorrow morning. Now I'm going to go ahead and pass this back to Susan so that we can get started.
Thank you, Lori. Again, I'd like to welcome you to the Emergency Preparedness and Response Plan series. This series represents the work across many states and territories as they have responded to state, territory, and local emergencies and the impact of those emergencies on the child care system. These 6 webinars support states and territories' development of collaborative emergency preparedness and response plan as framed by the Office of Child Care. The series has been developed in recognition of and with sensitivity to the fact that this is a very complex piece of knowledge, and we acknowledge that it takes not only multiple systems and stakeholders, but there are also considerations that trigger emotional responses, considerations for the needs of a community, so on and so forth. In addition, with awareness of individual states and territories' progress in creating a plan, some are beginning while others are revising and expanding their plans. So we took these things into consideration as we move forward in this series. Our focus today is on training and technical assistance supports offered to and for child care providers. We also acknowledge that this particular topic is related to all other areas noted by the Office of Child Care and in this webinar series that must be considered to develop a comprehensive state child care emergency preparedness and response plan. Oops. Excuse me. The speakers that have been involved with us are from both federal and state and or territory government, as well as national experts And we hope that your input and questions will also add to our discussion. Again, I want to remind you that we do look forward to questions in the Q&A box at the top of your screen, or please feel free to give us an example of something occurring in your state to trigger some other thoughts from the presenters and our panelists today. The webinar is designed so that states and territories may choose sessions of interest and need. States may have this as a TA goal, and we strongly encourage those states to participate in all of the sessions that are taking place. Again, participants will be asked to interact via the chat. We also are including word cloud, polling, and the question and answer box. So a number of places where you can chat with folks, ask questions, and participate as the webinar proceeds. The webinar and the resources from today and those thus far will be archived, and technical assistance may be available to CCDF lead agencies and your partners through the State System Specialist Network in collaboration with the Child Care TA Network partners and regional offices for ACF, Administration for Children and Families. Please know that all lines are muted in order to provide the best audio experience for the participants, as has been said by Lori, and we will be compiling the questions and answers following each session and provide a helpful, what we believe helpful FAQ resource following the series. The webinars are being recorded and they are being transcribed and archived as future resources. So with that, we'd like to move to our first poll question for today. We know from the registration process that we have representation across all regions and from 35 states and territories. We have approximately 146 participants registered for today's call. So we're really excited to hear firsthand and see firsthand who is with us. So if you would take your time to fill out the poll. So thus far, we are seeing good representation from child care resource and referral agencies and other community-based organizations. So we're glad you're all here. We know how critical you are to this work. State and territory administrators and staff, we're glad you're here as well. And we're seeing that number at around 31%. Regional offices are also joining us, as I've mentioned. And we're really glad that everyone is here today. As you can see, it takes a moment for things to move back and forth, but as we move forward with poll 1, you'll have another opportunity in just a few minutes for another poll. So today's agenda begins with an overview of this topic on emergency preparedness and response, with the specific focus on training and technical assistance and some key considerations as states and territories move forward in your work. Michelle Dizon, in partnership with Brummel Murphy, will provide highlights of Kentucky's work with a focus on the state online training and provider plan template that they have put in place, including the update on a related resource and background that has shaped their work in Kentucky. Liz Kelly of Maryland will share with us a state overview of the history and regulatory requirements for emergency preparedness and response in Maryland, and she will take a specific look at Project Security Blanket, which offers training and technical assistance for child care providers on the development of a written emergency plan for their programs. Following Maryland, we'll hear from Nancy Ward in Indiana, and she will discuss the state's emergency response planning guide for child care providers, including the training, issues to consider, and lessons learned that are underway in Indiana. And lastly, we'll hear from Lynette Fraga from Child Care Aware of America, who will highlight national trends in EPR training and technical assistance offered by CCR&Rs, elements of strong training programs, and a couple of state examples will specifically be noted in addition to what our presenters are offering today. So we'll also get to hear about some other states as well. Throughout this webinar, we have time allotted for polling, as I've mentioned, with all of you participating as well. And as we move forward in the later part of this session, you'll have a chance to actually have a Q&A time with the presenters, again, using the Q&A chat pod. So, as I've just reviewed, our speakers for today are noted here. We will be having an opportunity to hear more from them, and we are very pleased that they are able to be with us today. To maximize their time, we will provide their biographies and contact information along with this PowerPoint, as has been our practice throughout this webinar series, directly following this webinar tomorrow morning. I'd also like to take the time to introduce the Child Care State System Specialist Network EPR Plan webinar team, a mouthful, I would be assured there. And my first colleague is Abby Cohen, who has been working as the team lead on this effort. Abby is the State System Specialist for Region 9 and has been critical to our moving forward in this work. With us also on the team are Gail Kelso, State System Specialist working with Region 6, Lori Sommerfeld, who you've heard from, who works in our central office and is instrumental not only in our logistical work, but also in supporting the work of all of the team as we work with you in the states and territories directly, and then myself, Susan Rohrbaugh. So now I'd like to turn us to the next interactive part of our agenda, to developing a word cloud. Our word cloud today is focusing on emergencies and what comes to mind as we think about supporting child care providers. The word cloud will help us by allowing each of us to record words that describe our response to the question that is coming forth here in just a moment. And the question for today is, what might be missing and what might you think about as you think about the support that is happening in your state and territory and/or territory for providers? So again, what might you think about regarding EPR and supporting child care providers? What words come to mind? And I see that, Lori, are we moving forward now with that? Okay. It's been a moment for my connection. I wasn't sure, Lori, if everyone else is getting the connection. Okay, there we go. So please put in words that come to mind as you think about, when you think about EPR and supporting child care providers, what words come to mind? Especially when you think of training and technical assistance. And as you can see, those words are definitely popping up as key thoughts that folks are thinking about. Also beginning to note collaboration, practice, exercises, partnership, transportation, children, planning. So a lot of different thoughts are coming to folks' minds about the topic. Families, prepared, communication, response, great, assistance, safety. So let me say, those bigger words are the indications of what resonates most with all of us. You will be receiving this word cloud along with the other resources following today's webinar. So it'll be a safety, something that you've got for yourself as you move forward in working in your states and territories that you can carry forward in your ongoing work. You know, since we have been together in August 18th, we've seen a number of wildfires, numerous instances of flooding, heavy rains are occurring across the country, hurricane and tropical storm warnings, inability to drink water in a metropolitan city, communicable disease outbreaks are becoming of concern, and now we're moving into preparation for the influenza season. So it's very timely, again, that we're thinking about child care providers and their role in working with families in times of emergency or disaster. Thanks so much for your participation in this word cloud. It really brings forth a lot of key concepts and ideas for us all to consider, and some of them, or all of them, I hope that we touch on today. So Lori, if you would turn us back to our PowerPoint slides. I will continue just setting the stage, everyone, as we move forward to our speakers this afternoon. So I just want to speak about, as I've mentioned throughout today and has been mentioned in this webinar series, that this series is really designed to support states and territories as you think about and use your emergency history in being prepared for emergencies and disasters. On this PowerPoint slide, you can see 4 specific reasons why child care and planning for emergency and response is important. And I think those of you who have experienced a disaster, experienced an emergency, can definitely relate and understand these concepts. And to those who haven't, thank God that hasn't happened, and let's keep working for preparation and movement. But again, planning minimizes likelihood of injuries and deaths for those most vulnerable. Preparation minimizes psychological impact and definitely promotes resilience in both children and adults. Planning really does help us all as we think about revenues that are lost, continuity of care, provider liability. And lastly, I think all of us participating today on this webinar know that child care is a vital service to our communities, and we definitely want to be there in our communities and for our communities in any time of an emergency or need. This particular slide has come forth throughout our series, and if you attended our very first webinar, Amy Spates of the Office of Child Care described the Office of Child Care's rationale for requiring emergency preparedness and response plans. Amy stated in the IAM of 2011 that it was developed with the goal that each lead agency for child care will develop and maintain a written, comprehensive, multi-hazard plan to address emergency preparedness, response, and recovery specific to child care services and programs. So here in our 4th webinar, we are focusing on training and support of child care providers, which is part of the noted goal number 3. We separated this particular topic from the last webinar so that we really could spend some time in looking at what is happening across the country, in our states and territories, and even in our communities that are working to address the training and technical assistance for child care providers and programs. So the information memorandum, goal 3, technical assistance for child care providers, is highlighted here as to 3 key points that the Office of Child Care suggests. And in suggesting that as we look at these points, you'll hear again from our state presenters and from Child Care Aware of America today, specifically about how they are communicating about preparedness before, during, and after an emergency or a disaster. In addition, you'll hear more about emergency preparedness and recovery highlights regarding requirements, approaches, and resources for provider training that our 3 state panelists and our Representative Lynette from Child Care Aware of America will be sharing from the CCRNR system. And lastly, Lynette will also be sharing, as will our other state partners, what is happening with CCRNR and others in working on training, technical assistance, response, reporting, and recovery. So with that, we're going to turn to slide 3, or poll 2 rather. What types of EPR training and technical assistance is your state or territory providing child care providers? So if you take a moment, and please feel free to select all that apply. We ask you to fill out what is happening. Right up front, information regarding approaches and strategies for emergency preparedness and response is high. We're seeing the others coming in as well. And please, if you are you think of something that's other, would you please put other into our chat box? That would be very nice. So still very high on information is being provided. It looks like there are opportunities that are being had across the states and territories in providing guides, toolkits, checklists, or brochures and templates. Again, some of which you'll hear about this afternoon on this webinar, or morning, wherever you may be. Okay, it looks like we have most of the respondents in. And thank you for that participation, because we're going to now take you to poll 3, looking at what types, or who is providing the training, sorry, you just did what types, Now, who is providing the training and technical assistance to child care providers in your state or territory? Again, feel free to please select all that apply. So we have a range of different providers of T&TA around emergency preparedness and response. "75% of you who are on the call today are indicating the state CCR&R or the local R&R agencies are conducting training in TA. We have some representation talking about our friends at higher education or professional development entity associated with the state and providers, state child care licensing office, and then we have other in state or local agencies. So a mix of emergency management, Homeland Security, Extension Office, you may think of some others. And again, you'll hear some of these vast examples that you're noting here in the poll from our presenters here this afternoon. Great. And if we missed any one, would you put into the chat box what other groups we may be missing that you work with? Thank you. All right, so we are ready now to move to the opportunity to hear from our first state presenters. Michelle Dijon of Kentucky and Brummel Murphy, also of Kentucky, are here today to talk to us about the Kentucky experience and what they are doing in training and TA. So with that, Michelle, I will turn it to you.
Good afternoon, everyone, and thank you for having us. Kentucky is just honored to be asked to share what we've done in regards to emergency disaster preparedness for child care. As Susan had stated, I'm in the Director's Office of the Division of Child Care. I'm going to give you an overview of Kentucky's Division of Child Care Emergency Disaster Preparedness Technical Assistance Guide. That's a mouthful. And then my colleague Brummel Murphy, if time allows, will share some of how the technical assistance portion of emergency disaster preparedness here in Kentucky. So I'm going to go from the perspective, I'm going to tell you a story. Kentucky's Emergency Disaster Preparedness Technical Assistance Guide came to fruition through statutes and regulations. Kentucky's legislative branch has the task of making state laws. Its powers include passing statutes and regulations. Also, as a side note, I've included several hyperlinks in the PowerPoint presentation. I strongly recommend that you don't click the hyperlinks in today's webinar, that you look at them after the webinar is sent to you, because you may not be able to get back to today's presentation. The first statute for emergency disaster preparedness is KRS 199895. Kentucky's statute passed in July of 2012, and this was in the evacuation plan required for child care providers and family child care homes, with an annual updating of the plan, a provision of the plan to local emergency management officials. The next slide gives the key requirements for Kentucky's emergency disaster plan for child care providers: a designated relocation site and evacuation route, procedures for notifying parents, ensuring family reunification. We require documentation or instructions if there are any special needs. And the key thing is we found challenging was the coordination with local emergency management officials. And then the plan has to be updated by December 31st each year. You'll be getting the presentation, so I won't go over every bullet. Provide an updated copy to local emergency management officials. So the statute was passed and it became law. Our next step was to bring more clarity and direction to the statute in our child care regulations. The next phase was putting the regulatory requirements in each one of our child care requirements. A emergency disaster plan is required for all licensed centers at application and renewal, and our family certified homes at application and renewal. We also have a component of the plan for our registered in-home providers of the Child Care Assistance Program. And when you receive the presentation, there are hyperlinks to each one of these regulations. Our requirements are monitored through county emergency managers, monitor the quality of the plan and follow up with the child care provider if technical assistance is needed. Also, child care licensing staff check for completed plans at initial monitoring visits and for updated plans at renewal monitoring visits. And the monitoring staff are trained via statute and regulatory requirements. So that's the history, the background, the basis of Kentucky's emergency disaster preparedness training. So we have the statute and the law, and we wanted to, what would be the most cost-efficient, best way to roll it out, and it came out, so we knew we had to collaborate with partners. We collaborate with Child Care Aware, our county emergency folks, and Kentucky's public health preparedness staff, and our health department, our Healthy Start consultants. So through collaboration, we developed and designed a free online tutorial. This is a link to the tutorial. It is a free tutorial to give the basic essentials of emergency disaster preparedness. Providers can access it online. There's a table of contents of the tutorial. The important part, though, is in the tutorial we have embedded our planning form, which was designed through collaboration, and then we give suggested best practice or other forms to help child care providers address emergency disaster preparedness. Our provider form and template is 11 pages. We abstract the regulatory requirements of the form because emergency disaster preparedness is a very comprehensive, complex subject matter. And then we included in our tutorial, our technical assistance guide, the online training, all of these other forms to help them. The online tutorial or technical assistance guide is accessible to the division's website. We also have what we like to call our one-stop shopping center for child care providers and our technical assistance collaborative partners. We link to the tutorial and the collaboration with the county emergency managers with a listing of every county's emergency manager are posted on these websites. In the tutorial and on this website, all questions are directed to childcare.regulation@ky.gov email address. And that's the history of the training component. And I guess, Brummel, did you want to give a few minutes about the technical assistance?
Oh, I would be pleased to. So from a technical assistance standpoint, what we found happened in Kentucky was they passed a law that all child care centers and certified homes would be required to have a plan. But the regulation's not real big. You must have a plan. You have to share it with your family, so you have a plan for reunification. You have to address special needs. And so what the Division of Child Care did was they teamed up with Child Care Aware, the emergency management agencies, and developed this template, which Michelle mentioned, which is awesome, but it's very lengthy. And what our Child Care Aware staff who were working out in the communities with the providers one-on-one found was the template was very overwhelming for them. As we share our online tutorials and that kind of information, some of our providers in Kentucky honestly don't have access to that. In our rural areas, there's not a lot of internet. And so the TA folks statewide kind of took it upon themselves to carry these templates with them and do a lot of one-on-one coaching of the providers. And about November of last year, we received a call up at the Division of Child Care, and Jefferson County, which is Louisville and Jefferson County, it's our largest community in the state. Their emergency management agency was actually calling the Division of Child Care. When Kentucky implemented the regulation and the law, they said that each of our providers should do a plan annually and should submit that to their local emergency management agency. And we found there was a bit of a disconnect in that they were doing the plans. The TAs were helping them get them done. The surveyors were seeing the plans, but they were failing to share those with their emergency management agencies. And so in Louisville area, in our T&TA region, we actually got together and said, how can we solve this problem? And so what we did was we started hosting our counties emergency management agencies in some presentations, and we found this was honestly the piece that was missing in the puzzle. Emergency management agencies across our state have been meeting in front of groups of child care providers and directors and owners to present the things that need to be addressed in their area. For example, in Louisville, Jefferson County, we did some discussion on lockdown situations, whereas, 2 counties over, their big discussion was the fact that they have a plant there that uses a lot of chemicals, and they've had some spills in the past, while another county faced flooding problems. So the actual individual emergency management agencies working hand in hand with the providers has truly been the key to assure that providers understood what the plan was for. And when they sat down to use the template after that, they really understood what they needed to think about when they were trying to make a plan to ensure that they could safely provide care for the children if there was an emergency. And so I think that that was a huge key in this, and it's one that we want to continue. I think that's been a plus. Michelle, is there something else you'd like me to share?
No, Brummel, that's perfect. We're going to turn it back over to Susan. Our contact information will be sent to you. Feel free to contact us if you have any questions.
Thank you.
Thank you both, and thank you for your first-hand story. That was really nice to hear, Brummel, from an experience that you've had. And please know, again, to everyone, we will be having a Q&A at towards the end of our call. We already have received a couple questions, and so we look forward to more. So Brummel and Michelle, stay on your toes. More to come. So I'd now like to introduce Liz Kelly of Maryland. Liz, I'll turn to you right now, and you can talk about Maryland and your experience.
Thank you, Susan, and we're very excited to be here today as well and have a history of emergency and disaster preparedness in Maryland. Our story is a little bit different than Kentucky's. We've been around for quite a few more years and started from our own agency, actually. One of our staff persons was involved in developing our agency continuity of operations plan and decided that it would be a good idea for our child care providers to do the same. So back in 2005, 2006, we started the process of developing what that criteria would be. We put together a scenario by which we would try to get information out to our child care providers. And in 2007, 2009, we awarded a contract to Chesapeake College, one of our higher institutions of higher education in our state, to develop and implement training that would be for the child care community across the state. In Maryland, we license all child care providers, family child care, anyone that cares for a child that's unrelated to them in their home, child care centers, religious affiliated programs, what we call letter of compliance, and all of those types of programs are required currently to have an emergency plan. So the first wave of this was, it was not yet required. This was just voluntary training that was out there for providers to participate in, and it cost at a cost of $500,000 for a 2-year contract. In 2009, there was legislation that was passed that put into statute what we were already doing. So the Emergency and Disaster Training and Plan Development was placed in our regulations, and they were enacted to require that each one of our child care facilities have a current emergency and disaster plan in place. Prior to this point, we did have requirements in our regulations for an evacuation plan, but it was pretty much just for fire, in case of fire or you had to get out of the building for an emergency. It wasn't specifically stated as far as all of the various components that needed to be addressed. And then since 2009 and through present, we continue to support the project in the amount of $250,000 per year, and this keeps the price very low and very cost-effective for providers at $15 for that training session. The regulations that were enacted cover a variety of different aspects. At least one person from the center or the family child care provider must complete a training. During that training, they actually developed the plan. So we thought it was very important not only just to provide people information about what the training should encompass, but actually have a specific training and have the plan developed during that training. Then, once that plan is developed, each employee of the facility, whether they be a center employee or a family child care home employee, must receive an orientation session about the contents and know what their responsibilities are. And you can see on the slide all of the various content pieces. It has to contain information about local emergency operations, the assignment of the staff responsibilities so everyone knows what their job is during an emergency, the list of local emergency services numbers and radio stations and so forth, and then procedures for evacuation, relocating staff and children, sheltering in place, notifying parents of children, and addressing the individual needs of children, including children with special needs, similar to something that Kentucky mentioned as well. The additional requirements have to do with how to respond. So in the event of declared emergency, what they would need to do, they have to practice this twice a year, and they have to maintain a record of those practices. We tell them twice a year for emergency and disaster preparedness, they have to practice their plan for fire at least once a month, and they have to keep records of all of these various times that they practice it. We also are licensed, what we call licensing specialists. Our staff, the state staff that go in and monitor these facilities, are required to ensure that there is a current plan in place, that it has been, the staff have received that orientation, and that it has been practiced as appropriate or as required by regulations. What I really want to spend the time on, though, however, is the actual training and preparation of the plan itself. It is called Project Security Blanket, and it is a training and technical assistance program for child care providers. As I said, the biggest part is the training that goes along with it. It's a 6 clock-hour course that's presented in person or online, and it includes training about what is emergency and disaster planning, how to develop the plan. It provides the programs with a template that they use, so it is very standardized. It's easy for the review process, and it's also very easy for the licensing specialist to see that the plan has been developed and updated as appropriate. Resources for developing the plan, technical assistance in developing the plan, and then very key, plan review and acceptance. In addition, with our contract with Chesapeake College, they also keep a copy of the plan so that if at any time a program loses their copy or can't find it, they can always request a replacement and have that provided to them. During the training, I said there is a website that all the information is kept on. You see the link there. It includes information about announcements, resources, a list of the approved trainers, and these trainers are located all across the state. There is also an updated training calendar, so at any time during the year, a person can go on to this website and find out where training is being offered in their area, the option for the online training, and then there is a long list of emergency and disaster information. As you can see on the screenshot, and it is quite small, but there is information here about what they get during the training. They get the workbook, they get the template, they also get a backpack, a flashlight, and refreshments, which always is a good thing to have during training. We get excellent feedback on the training that is provided during these courses. What I did here was just to provide you a screenshot of what is available under the Emergency and Disaster tab on that website. So you can see by the drop-down, there's information about all types of emergencies that they need to take into consideration or they might have to put into their plans. Everything from fires and explosions all the way down to different types of family and community concerns and or violence. So it covers a broad range and depth of information that they need to take into consideration when developing their plan. The last thing I want to cover are just some of the various things that to consider when a state is thinking about developing training, technical assistance, and how they want to incorporate these things into their state requirements. I think it's extremely important, and one of the things that we did was to develop and provide access to the training well in advance of the regulatory requirements. So we weren't trying to catch up, and people had plenty of time to get their plans developed. And what we have found over time is that while we require only one person to have taken the training, that many facilities have a requirement within their own businesses that everyone has to go through that training. Not that they have to do the plan, only one plan per facility is required, but they would have the broad-based training on emergency and disaster preparedness. When you provide a template, it makes it much easier, as I referenced earlier, for the providers to develop the plan. They're basically filling out and answering various questions. It's very easy for the trainers to review and approve, and also for the licensing staff to know what to look for. To develop the standardized training is very good as well, because that way you know that there's consistency of information and everyone is getting the same information across the board. And lastly, to include in the development and the review of the plan in the training, so that there's no need for further review by licensing staff. All they need to do is to look to make sure that it is there in the file and that it is kept updated. So that is the overview for Maryland, and I will turn it back to Susan.
Thank you, Liz. And again, I think as you've all been listening, I know I've been learning much from both of our states thus far. So I already am thanking Kentucky and Maryland for sharing their experience. And now we'll turn to Indiana and hear from Nancy Ward that I previously introduced. And Nancy, will you please tell us about what Indiana's guide is about and what else is happening regarding emergency preparedness and response in Indiana, please?
Sure, and thank you very much for inviting me to participate in this webinar. It's really an honor to do that. Back in about 2011, when word came out from Washington that agencies needed to put together some planning guides for child care, a group that was started by the Indiana Department of Homeland Security brought together a number of people from different agencies and all stakeholders in early child care. And over the course of about a year and a half, they put together a 45-page guide, which is pretty good for the group of people that got together. It's fairly user-friendly, pretty comprehensive. 15 pages of the guide are devoted to checklists and forms that the child carers can use. The guide debuted in the spring of 2013, and the two nurse consultants that are employed by the Office of Early Childhood and Out-of-School Learning have a one-hour presentation that we take on the road and present live to child carers But since the debut back in the spring of 2013, we've been very disappointed with the numbers. We've presented about 10 times. We've had just a few over 100 participants, and that doesn't speak very well to training child cares. But in looking forward, we thought, well, we've had some good luck with our state R&R, and we do a number of webinars, so perhaps maybe we can do an asynchronous training, and we put that together. It was the nurse consultants and Homeland Security. We put that together, and in the first month, when it debuted in June, the first full month, they had 174 views. So that's obviously a very helpful way to get training out. I took a look at what some child care centers did, a very unprofessional survey, just email, to see what they thought their biggest threat was. And we got some information back from 9 all over the state, different types of settings, large centers, small centers, registered ministries, licensed homes. They see their biggest threat as weather and disruption of power. Pardon me while I forget to advance the slide. Their biggest training need, the thing that they figure they need training on the most, is the unfriendly armed intruder. Some places have really nice security, some don't. And then how do you train staff for something like this? And do you have children present? That's very controversial. And then from the staff of the Office of Early Childhood and Out of School Learning, we've learned that when we go out and visit, we see that agencies are unaware of what the rules actually are. There's little planning past the moment. They seem to know that they have to do fire drills monthly and tornado drills during the season, but outside of that, they're unaware that flood and earthquake also need to be practiced. So they talk about communication issues as well. Not everybody has overhead. Sometimes cell phones don't work. Buildings are very tight. And then you have the issues of families in your urban areas with short-term phone numbers and child custody issues. So there's a lot of concern there as well. So I talked to 2 child care centers. Both are in our Paths to Quality, our voluntary quality improvement program. They're the level high. They're nationally accredited. They accept CCDF funding. One had a flood. And this is a very well-prepared agency that is on the site of a large corporation, and they have a lot of support from that corporation. And they knew they were in a floodplain, but had thought they had prepared enough. They built the child care up higher than what was initially recommended. But it was flooded. Fortunately, it was not when the children were present. It was a Saturday. But come Monday morning, they couldn't get in, and they had to be closed for 2 weeks while they found another site and had to have that ready. One thing that this child care does have that they benefit from being on the site of that agency is that they have a great security system. They also have an on-site within the grounds, a second place where they can go if they need to evacuate from the child care site, and it has duplicates of everything in the child care. Duplicates of paperwork. They don't have to take anything with them. Medications are duplicated. Everything is so that they can go to the other site. Second child care that I talked to had an active shooter in the parking lot. Surprised them completely. They knew the parent, and their initial concern, this happened very early in the morning, was to get the children to the back of the building because it was an open concept building, and they didn't want the children to see what was happening in the parking lot. So they did that. They have a security system on their door, but it's parent driven, so it's a code that the parents can enter so they can drop their children off or pick them up. They're in a more urban setting. They have a lot of custody issues. They have a lot of parents who have phone issues. They have difficulty with reunification. They've identified that. When they evacuated that site after the shooting, they got children to the back of the building, and the police came and took them next door to a fast food restaurants, which they locked down then for the children because the shooter was still out and about. They've done some things. They have sister facilities nearby, so if they have to close their facility, they can use a sister facility. One of their sister facilities that's nearby is in a more risky neighborhood, and they've actually installed a police scanner, and they share that information that comes over the police scanner with other businesses and child cares in the area. So that was a very helpful thing for them. After the shooting, they did employ a fellow to come in and talk to them about things that they can do within their to protect themselves and the children, like when you come in early in the morning and it's dark, to carry mace and to come in pairs and things like that. So some other lessons learned. I talked with these agencies about special needs children, and one manager smiled and said, "Oh, all the children can have special needs," and she's right. They identified one-on-one assignments are a must, but that a child care has to be prepared to assist others as well. She talked about a time when a child inadvertently triggered the fire alarm and nobody realized that he'd done it, and they had to evacuate. Well, some children didn't wake up to the fire alarm. We talk about accommodative equipment, chairs, braces, hearing aids, glasses, communication devices. When does a child use it? How often? Where is it stored? Is it easy to take with you? What if you're not in the room where it's stored when you have to evacuate? How do you get those things? How do you plan ahead for that? Those are really important. Some children might need headphones or earmuffs. That might help them as they transition out from one place to another. Or a transition object, that toy or blanket that stays in the backpack, but might be really helpful during a meltdown or a rapid exit of the building and prevent a meltdown. Planning ahead is a must, and it's for any type of emergency that you can imagine. If it happens at one child care, it has the potential to happen at another. It's important that they not practice the same way all the time. It's helpful to use a red trash can to indicate a fire so that routes can be changed. They need to pretend that phones are down when their tornado siren goes off. And how do you contact parents to let them know that everyone is okay? It might be, you might have to use the media, and many are not aware of this. So what's Indiana's plan? Because we all know that from the Save the Children report, Indiana's not very highly rated there. So we've got these types of training, the live, asynchronous, and what we've discovered, we know that we need to have a higher level training available for those who are in leadership positions. And we recognize the need for supporting and educating child cares, and we're planning a mass email distribution of our guide that we have, which is available online, along with a list of resources available for training on this topic. So those are some things that we're working on. And I don't think we have a link. I don't have a link to the guide here. Hopefully that will come out when we have when they send out the thing to everybody.
Thank you, Nancy. That sounds like a great plan, and it is something that we'll add to our list of things to make sure about. I also just want to say, I don't know how many of you noticed, but to Oklahoma and Jana, we are thinking of all of you, Jana, and your colleagues in Oklahoma right now. Apparently there's been an earthquake while we've been on the webinar. So it does go to show this is a time where we need to pay attention to emergencies and potential disasters. So thank you, Nancy. I appreciate you really sharing some local experiences. Hearing those up close and personal comments makes a big difference, I think, to all of us. So with that, we're going to turn to our next poll question 4. And so what topics are covered in your state or territory, EPR training and technical assistance? And you're all right in there already. Great. Please, again, select all that apply. And requirements and rules is definitely topping out. Always good for folks to know requirements and rules. seeing a lot of interest around community connections and resources being built, sample plan and templates available, things that are very high on our agenda here this afternoon that we've been talking about, communication and reunification with families, one of the most critical elements of our work, and then being there for children with special needs, disabilities, so a lot of good training taking place. Those of you that are putting in other, if you don't mind typing in other into the chat box or to the Q&A box, we will capture that information as well. Thank you for that, if you would. Community connections definitely came up higher as you all were reporting in your experiences. And we have some other comments coming in. NIMS or ICS structure to support providers' ability to work with emergency management directors. Thank you. And we'll make sure to give everybody the acronyms as we move forward. And we've lost some audio. Lori, maybe you could help there or make comment to that to Sonia. All right, if we could move on then, we'll move to our next presenter here this afternoon. Sonia, we'll try to see if we can help you. So our next presenter here this afternoon, we're very pleased to have Lynette Fraga with us from the Executive Director of Child Care Aware of America. Thanks, Lynette, so much for joining us today, and we're really happy that she in particular, could join us with her state presenters because Lynette also has some current information that she's been learning from the R&Rs across the country. So Lynette, we'll turn it to you.
Wonderful. Thank you so much, and thank you for the opportunity to share about Child Care Aware of America and spotlight child care resource and referral agencies and our collective work in this area. I, again, am honored to have the opportunity to share some information with everyone. So I likely am going to need some assistance with advancing the slide.
I will
so if you could see the next slide, that would be great. Thank you. Child Care Aware of America, for many of you who are familiar with our organization, we're a national membership organization of resource and referral agencies across the country. Since 1987, Child Care Aware of America, and many of you who are affiliated or are resource and referral agencies yourself are on the phone, so it was great to see that in the audience poll of earlier. Know that we provide training and research practice standards to child care resource and referral agencies, promote national policies and partnerships that facilitate access to high-quality child care. Our reports are critically important to us in the field around child care data and research, and like was just mentioned, we'll share a little bit of some research and some information we've gotten from the field on the emergency preparedness front. And we offer child care and parenting information through Child Care Aware as well as throughout the country with our resource and referral agencies, connecting parents and families to information about child care resource and referral services in their community. Next slide. So as was shared, we recently conducted an informal and brief survey with our child care resource and referral members to give a snapshot of what some child care resource and referrals are doing across the country around emergency preparedness and response. And as you can see, we got some interesting feedback. We had respondents from over 20 states, and they provided us with some excellent information about emergency preparedness training and technical assistance. If you look to the left slide as you're looking at the screen, training for providers around emergency preparedness and response was one of the top 4 responses we received regarding activities child care resource and referral agencies are facilitating or taking part in, along with assisting in the development of emergency plans, as you can see, and assisting providers and families throughout the recovery process, which was somewhat aligned to what we've already heard earlier in the presentation. Another note of interest, which we thought was important for the audience today to see, is that many respondents, and again, these are resource and referral agencies, felt that their states were somewhat prepared. So you can see, you could either say little or no preparation, somewhat prepared, or very well prepared, that some states felt that their states were somewhat prepared, with few respondents declaring that their state was not prepared at all, or that they were very well prepared. So again, a bell curve here, and that those that responded, again, we had about 20 states respond, felt that they were somewhat prepared, but that potentially there was some work to do to feel very well prepared. Next slide, please. So as we go to the next slide, we asked the question, what were some of the main kinds of training and technical assistance that child care resource and referral agencies offered to providers? And what we can see is a nice balance between on-site training and technical assistance, online training, and developing and providing resources. And additionally, we got a snapshot of what topics were the most consistently covered by respondents in their CCR&R's training and TA. While it was interesting to see that communication and reunification, supporting children with disabilities, as two topics that were only covered by about 40% of respondents, it was encouraging to see that over half of the CCR&Rs that responded were training providers around requirements and rules, social and emotional needs, example plans, and community connection and resources. And again, as compared to what we just shared, it was pretty much aligned to the quick poll that was just taken. Next slide, please. Great. This, I think, is a fairly interesting slide as well, because of particular interest from the survey was where respondents saw the largest gaps related to emergency preparedness response in their community or their state. So again, as you look at these significant gaps, about 50% response was that supporting children with disability was a gap area, and as well as materials and resource development. So although there are some materials and resources available, these are areas where folks really are interested in filling a gap. And again, it's not surprising that supporting children with disabilities was considered the largest gap in many states, with half of respondents citing that it was lacking in their states, with only materials and resource development as the second closest, at 44%. And in our poll that we just took, I took a quick note noting that the lowest response rate was in terms of supporting emotional and social mental health, as well as supporting children with disabilities. So I think this is an area that we can explore a bit further. Next slide, please. For context, I'd just like to quickly speak about CCR&Rs and the services they provide. I'm sure many of you have worked with CCR&Rs that are on the line right now, and of course about half of you are CCR&Rs. And there is a significant amount of training and technical assistance. More than 650,000 child care workers each year are receiving training from CCR&Rs. And if you look at the topics in the training, again, emergency preparedness and response, as well as child development and health and safety, are just some of the topics that are covered. Next slide, please. So to transition now to elements of strong state training programs, we're often asked what makes a strong state training and TA program for emergency preparedness and response. And for us, the elements that comprise a strong EPR training program include widely available and easily accessible to the public, so having information online and our on-site learning opportunities in addition is very helpful. That topics cover all or most aspects of disaster and emergency planning, response, and recovery, much of what was reflected in the commentary that was made earlier, covering everything from assisting communities, families and children with trauma recovery after an emergency, community resources available, and of course, again, what comes up often is ensuring we're prepared to support children with special needs or disabilities. And finally, to think about how this may be incorporated into QRIS systems. Next slide. The next slide is speaking to technical assistance. And I just want to make sure that as we're thinking about technical assistance, for us, elements of a strong TA assistance program includes revising emergency plans, building connections and networks for communications and reunifications, providing templates, forms, and resources, and assisting provider recovery efforts as well. Next slide. With the very little amount of time that I have left, I just want to ensure that, I have an opportunity to emphasize a couple of different states that are doing interesting things as it relates to emergency response and preparedness and engagement with child care resource and referral agencies. In Iowa, for example, community-based child care nurse consultants and CCRNRs deliver emergency preparedness for Iowa child care providers, training to home and center-based child care providers across the state. The training is actually based on Child Care Aware's formerly known as the National Association of Child Care Resource and Referral Agencies, or NACRA, disaster preparedness, a training program for child care centers. One of the most interesting features in that is in Iowa, providers have the ability to schedule trainings to be available through statewide public broadcast channels, checking off one way to ensure that the training is not only widely available, but also easy to access. Next slide, please. And in Connecticut, the Department of Social Services worked with Save the Children and United Way 211, the Division of Emergency Management and Homeland Security, and the Department of Public Health, and Connecticut charts a course to identify emergency preparedness gaps in the child care community. The charts a course child care emergency training was delivered to over 350 child care providers, and essentially briefings on the unique needs of children in emergencies were delivered to emergency management personnel, again, so critical, as well as legislative language being passed by Governor Malloy, ensuring that child care is incorporated into the civil preparedness plans at the Division of Emergency Management and Homeland Security. Next slide, please. So quickly, the top 5 ways that CCRNRs are engaged with emergency preparedness and response: training, making connections to the federal, state, and local agencies, developing plans for evacuation and response, assisting child care providers with the recovery process, including assessing damage and safety, and finally determining programs directly impacted during an emergency or disaster and possibilities for shifting children and families into non-impacted programs. It was mentioned earlier that that was part of a process, staffing temporary care shelters if necessary. And finally, we do have materials and resources available, and big breath, turning it back over to our facilitators.
Thank you, Lynette, and thank you for the invaluable information you provided. Not only have we been able this afternoon to hear from 3 states here in our areas of expertise, but we've also been able to hear more from you, Lynette, about what's happening across the country, specifically from the R&R network. So that's very helpful. Thank you. So we'd like to now open this portion of the webinar to respond to questions from any of you, and we have been getting questions here this afternoon. So Abby, I'm going to open it up to you right now because you have the questions that you can start us off here. And we'll be hearing from our presenters, our speakers here this afternoon. Abby?
Okay, thanks very much. I wanted to follow up. There are several questions that have been offered. I wanted to follow up with Michelle. One of the questions that we had to do with the fact that in Kentucky, the emergency managers are reviewing plans, and so someone asked, how many emergency managers do you have to review the plans in Kentucky?
That's a great question. We have 120 counties in the Commonwealth of Kentucky. Every county has a designated county emergency manager. Here is where the challenge came in. Some of the county emergency managers are volunteers, could be the mayor, could be the county clerk, could be, so they are checklisting plans based on the statute, and then because of their limited availability, they're only following up with problematic plans. That answer the question?
Yep, that's great.
Thanks.
And we also have another question for Liz in Maryland. Someone had written in to find out in terms of the coverage of the plans and what is required, whether anything in the plan focuses on recovery.
Recovery as to, could you clarify exactly, like recovering their facility?
I think, again, because of the nature of the way that this works, we sort of have to surmise unless someone writes in further. But I would say whether there is any portion of the plan that the provider is expected to write about what happens as they, once a disaster has hit, either whether they can continue working in that facility or whether they have, for example, a backup facility or things that happen post-disaster, I suppose.
Yeah, sure. So in the plans, and actually this predated our emergency disaster preparedness criteria. They did, every facility does have to have alternative places where they can go, and that is plural. So depending on what the emergency might be, it may be just a place that they can exit the building. It could be another location entirely. And then also within our regulations, they would have to work with the licensing office to make sure that any facility that they may go to after an emergency, if they are not able to go back into their current location, that facility can be looked at and to make sure that it maintains a certain level of health and safety.
Thanks, Liz. And I do want to mention here in terms of, recovery and rebuilding and the long-term aspects, that is the focus of our next webinar on October 20th. So we'll come back to that, but I did want to mention that we'll have a whole discussion in depth about that. I wanted to go back to Indiana and ask Nancy if you could tell us more about the response you've received from providers to the guide and a little bit more about their reaction and how they've been able to use it.
Well, that was actually one of my questions in my little unscientific poll, and actually I sent the guide out to those, probably 50 providers along with my email questions, and about half of them were not aware of the guide, even though it's available free to them. All of our licensing agents have it, all of our CCNRs have it, and it's available online. So that was a little surprising. But yeah, that was one of the questions.
Well, okay, and I do think that is something that all states need to consider, is how to actually focus on the best outreach to the provider community, and clearly resource and referral agencies that are on the phone are involved in that every day, but there needs to be different approaches with different providers. What about Maryland, if you could share, Liz, what do you feel like the biggest challenge was in the implementation of your Project Security Blanket?
I think in the beginning, the biggest challenge really was connecting with those local emergency management offices and figuring out exactly how to get our child care facilities on their radar and the communication. The other one of the challenges that we've had is in finding alternative evacuation spaces. Many of our child care facilities wanted to make sure that they could use perhaps a school in their area or a community-based program, and some of those connections were a little bit difficult. I will say that as most of the programs have, as we've evolved over the years, this has become easier to deal with. And the biggest challenge I think that we have now is how to explain to providers how to practice the various aspects of the plan. Just evacuating the building's easy. Sheltering in place isn't as difficult. The one that we have the most trouble with is in case of emergency, you don't have time to arrange for a bus or a charter that, and trying to help people to understand exactly how they should carry out the aspects of the plan. And that was one of the areas I think that I wanted to mention as well, is that once you've developed the plan, the next step as far as your training is concerned is developing a training around, now that you've got the plan, what do you do with it? How do you put it in place? How do you update it and revise it and ensure that you're covering all of the various things, especially as new situations come into play and you thought, oh, I didn't even think about that type of scenario. How do I now revise my plan to reflect that?
And I think both of you, both Maryland and Kentucky, I think highlighted the importance of this connection between the local provider and the emergency management agency, and that I think is true regardless of whether or not regulations require it. The fact is that providers really benefit from making that connection. We're going to turn to Kentucky and ask Michelle, similarly, what was the biggest challenge for you in developing the materials and template that you have for your providers in your state?
I would say the biggest challenge that we had found is our initial template was 33 pages long, and scaling it down to meet the requirements, address the need, but still have some components of best practice. So, and then the collaboration is always an ongoing challenge that we're working on with changes in emergency management staff. We try to keep our free online tutorial or online guide updated. That pretty much. Brummel, do you have anything to add as challenges?
Sorry, I had to unmute. No, that sounded perfect.
Okay, thank you.
Okay, well, I think that we have covered it. I think if anyone else does have any other questions, now's your time to type very quickly into the Q&A box in the center of your screen. And in the meantime, I will just ask Lynette whether there were any big surprises when you took a look at your survey from the R&Rs nationwide, and whether there's anything that Child Care Aware hopes to move forward on in this area.
Thank you. Actually, no surprises necessarily, other than point of emphasis. And again, that's the social emotional health and recovery for young children and all children. And I would say the other area that interested in us making a significant focus around is family child care, and ensuring that in addition to considering some special populations and special needs, how are we considering that particularly in family child care homes, and making sure that we're providing training and technical assistance to ensure, particularly during an emergency and for significantly medically involved children, that there is the information and supports available. I'd say another area would be what was mentioned a bit earlier, which were those emergencies that may not be weather related, that may be either violence in communities or other challenges within communities, and ensuring that we're taking that into consideration when we're building and providing materials and resources through the R&R system.
That's great. Thank you so much. I know that all of us will be working on many of these issues going forward, and I did want to just mention, in addition to the webinar on recovery, the last webinar will be on social and emotional issues, the resilience, and community mental health recovery. So this webinar series will focus on all of those issues that have been raised. And I think I will turn it back to you, Susan.
And thank you, Abby, and thanks to all of you for responding to the questions on the spot, so to speak, and your knowledge and insights were very informative, I think, to all of us. So as we begin to wind down here this afternoon, we are really excited as the State Child Care System Specialist team who's been working on emergency preparedness and response to share with you today the release of the recently updated resource guide, Emergency Preparedness and Response Resources for Child Care Programs. This is a 16-page document for providers which addresses many topics highlighted today in preparing before, during, and after an emergency or disaster. It includes links to state and national guides, to templates and other training, resources from the Office of Head Start, which are available to all of us, such as the upcoming webinar that the American Academy of Pediatrics and CDC will be doing here very soon in October. Also on the web, in this guide is information you should include in your evacuation plan, what should be included in your emergency supply kits, agencies and organizations to help with this work, such as those we've heard this afternoon, who are partners and looking out for the work together. So many, many resources in this 16-page document for providers, which should be very helpful and informative following today's call and as part of this series. In addition, other resources that we've been highlighting throughout this webinar series is we do have a number of resources on the Office of Child Care website regarding disasters and emergencies. Again, the information memorandum, joint letter that has gone to state governors, other resource guides, links to other resources, and so forth. In addition, on our Child Care TA network page for the Office of Child Care, we as part of CCTAN do have the emergency preparedness guide I just mentioned, as well as other resources noted here. And we're very happy to be sharing all of these resources. Please again hear me say that all registrants will receive the PowerPoint from today's webinar. That will help you in making all of these resources easier to find. And in closing out, we'd like to ask you one more poll question here this afternoon. Which of the following topics from today's conversation will be most useful in your emergency preparedness and response provider training and TA work going forward? So what have you learned today that you find will be most useful as you move forward with this work? And if you have something to say in other, please again, feel free to put that into our chat box. So hearing about resources, templates, and online training, definitely. We've had a lot of good actual examples provided here this afternoon. Many more coming that you'll be able to access in the resource guide. The trends that we've learned from the Child Care Resource and Referral community. Thank you for that on-the-spot update from all of you. And information and gaps and how we could proceed, and state strategies and approaches, all very helpful this afternoon. We thank you for that. And if, as we move forward, we would like to tell you that, as Abby has mentioned, and we'll go forward. Thank you. A little lag time on my computer, everyone. As Abby has mentioned here this afternoon, our next upcoming webinar is planned for October, and it will be covering response, recovery, and rebuilding. So we want you to be watching for that. And immediately following today's webinar, you will receive a SurveyMonkey evaluation, which will open up in your internet browser as long as your pop-up blocker allows it. And if not, you will receive a link to the survey when you receive the email follow-up, which will include the PowerPoint and other information from today's webinar. So please, we do ask you to complete the SurveyMonkey. We really do value your input, as does the Office of Child Care, and of course all of our presenters and speakers in the entire series has appreciated getting input and feedback. So concluding this webinar today, we again wanted to say we know that development of a meaningful, specific, comprehensive EPR plan is complex and time-consuming. Yet I think, as you can hear from our presenters this afternoon and throughout this webinar, it's worth it as we deal with and address disasters and emergencies, man-made or not. That in addition, state and territory supported training and technical assistance can be extremely helpful resources in this work of bringing together not only the child care community but other partners with whom to work in communities in our states and territories, and also providing resources and guidance from states, from those experts in emergency preparedness and response to providers can really better equip them to best assist families when emergencies do arrive. So we hope you take examples and ideas from today's discussion to a broader effort. Please know that technical assistance can be available through your state child care lead agency in your respective states. As mentioned, the next webinar will be held on October 20th, so mark your calendars, at 3:30 p.m. Eastern Time, and so forth, as you see on the slides presented to you this afternoon. Again, we want to sincerely thank our speakers, our presenters today, for their willingness to share their process, their progress, including the trends and approaches that are occurring for them and that we've heard about nationwide. And thanks to all of you for your active participation, and we wish you all the best as today moves forward. Goodbye.